Good afternoon. Alisa Haushalter, Director of the Shelby County Health Department, and I want to welcome you to the Joint Task Force update. I'm going to give brief updates, make a few comments, and then Dr. Randolph will make some additional comments, and Chief McGowen will provide some finishing comments, and then we'll open it up for questions. Unfortunately, this morning we need to report that we have an increase of 1,163 cases, and that brings us up to 58,762 cases. This really is demonstrative of what we said some weeks ago, is that we are anticipating a challenging fall because of the surges that occur for a variety of reasons, and now we're experiencing increases in cases relative to Thanksgiving, as well as ongoing interaction between people that's causing consistent transmission. One of the things we haven't reported on that I think would be beneficial today, just to use as an example, we know that the reproductive rate is 1.06 approximately. And so today we have 6,044 people who are actively infectious. That means they're able to spread the disease to others. We also anticipate at the current time, based on the amount of community transmission, that may only represent about 1/5 of those who are actively infectious at the current time and shedding the virus. But those 6,044 people, if we look out 30 days from now, they actually will produce almost 7,200 new cases. So 7,138 to be exact, and those will be added on to our cases as of today. Then we add new cases tomorrow and new cases the following day. The point there is that we really are in a place of exponential growth, and it's critical that we do everything that we can to bring that growth under control. So I'm going to pause there, turn over to Dr. Randolph. I anticipate today we'll also have a lot of questions, so we want to make sure we're leaving time for those questions. Thank you.
Thank you, Dr. Haushalter, Chief McGowen. Greetings, fellow citizens of Shelby County. It's Dr. Bruce Randolph. I'm the health officer. I just want to share a little information with you. Each week, the White House Task Force releases a report, a weekly report on each state. And so they released the report for the state of Tennessee, dated 12/13/2020. And I just want to highlight a couple of things in this report that I think reiterates the importance of where we are and what we must do. The report states that Tennessee has a current rate, the state of Tennessee has a rate of 639 cases per 100,000 population. When we compare that to the national average of 451 per 100,000 population, we're much higher than the national average. Matter of fact, Tennessee is second in all states in terms of the rate of new cases. Oklahoma is number 1, Tennessee is number 2. But in this report that is released by the White House State Task Force, it provides us with some recommendations. And based on their analysis of our data and our situation, the White House Task Force makes the following recommendations that I want to emphasize. One is that we should utilize all the antigen testing and other tests that we can, testing not only symptomatic but asymptomatic people. We should increase our mitigation efforts, such as reducing the capacity, closure of indoor gatherings, advising folk not to gather with people outside their immediate household. And then this startling fact and recommendation It says, and I want to read it so I want to get it completely correct. All public officials must make it clear that if you are over 65 or with significant health conditions, you should not enter any indoor public space where anyone is unmasked due to the immediate risk to your health. You're 65, or you have some underlying health issues, you should not enter a place where people are unmasked. It says that you should have your groceries and medication delivered. If you are under the age of 40, you need to assume you became infected if you gathered beyond your immediate household, and you should get tested. So I just want to emphasize the importance of where we are now and what we must do in order to protect each other. It says that, lastly, if you're over 65 or with a significant medical condition and you gather outside of your immediate household, you are at significant risk for serious COVID infection. So as our numbers escalate and as the holidays approach, we are looking at the Health Directive, and we are looking at what measures that we can implement to help address this escalating cases that we are currently experiencing. But again, I want to reemphasize that it's really up to you, the things you must do to stay safe and to help us in controlling the transmission of this virus. With that, I will have Chief McGowen to come to address you.
Thank you, Dr. Randolph, and thank you, Dr. Haushalter. Well, this is a sobering day. If the data just presented does not get folks' attention, I'm not sure what will. We have seen exponential growth of the virus in our community, as was predicted. And as Dr. Haushalter was talking, it just dawned on me that for people to get a grasp of exactly what we're talking about in our community, imagine, if you will, in days before the pandemic, if we had the entire AutoZone park filled with fans, filled to the brim with fans, and every person in the AutoZone park was suddenly infected with a very contagious disease. And at the end of a game, we let everybody out to go back to their neighborhoods, and fans come to AutoZone Park from all over the county and the region, quite frankly. If you could picture in your mind the impact that 6,000 or 7,000 people could have that are contagious, having left one place and gone out into the county and the region, I think everyone would take precautions, because you know that likely there was somebody you know that was at that game. So I'm using that just as a visual example to say that's the kind of volume of infection that we have in our community today with people who are actively infected. And on top of that, it's not just here, it's the entire state of Tennessee. Dr. Randolph said we're number 2 in the country. So literally, there is no place immune from this in our community. And so I implore all of you to take precautions. There is one bright note in that data. What you all are doing, what Dr. Randolph, what Dr. Haushalter, what Dr. Warren, Dr. Jane, Dr. McCullers have all asked you to do, to wear masks, to follow hygiene procedures, to get tested. Our rate in Shelby County is the 6th lowest out of all the 90-plus counties in the entire state. So what you are doing is working. But I want to reemphasize that this is the time to take precautions. You shouldn't be gathering with people outside your family. Yes, we have crossed a grim milestone of more than 750 cases a day. The data shows that largely people are giving this to one another, people with whom they are acquainted, people whom they trust, people whom they know, and the ways in which people are choosing to gather, whether it is in the home or at a public place outside the home, whether a church or a wedding or a funeral or another place where there are people gathered is largely where the transmission is happening. And so, I ask that everybody please take the precautions that you know. And as Dr. Randolph said, one of the strong recommendations from the federal government is to get tested and know your status. And so, you've heard me say it before, we have plenty of tests and test capacity still available. If you're worried about having an appointment or insurance, or you can't do it until after work, we have several drive-through testing sites that are open. Tiger Lane is open this entire week from 3 p.m. until 8 p.m. Please come out and get tested and know your status. We've caught hundreds of people who were asymptomatic, in other words, feeling no symptoms whatsoever, and were surprised to learn that they were COVID positive. They were immediately ordered into isolation and no longer can spread the virus to other people. On the weekend, we'll also open a drive-through at Poplar Labs from 8 to 5, as well as Tiger Lane from 8 to 5. So please, there's lots of testing. Go get tested and know your status so that you can isolate and not spread the disease to anyone else. There is good news on the horizon, and there is good news happening in our community just this week. Shots are going into arms as we speak to our frontline healthcare providers that kicks off a robust vaccination program for us here in Memphis and Shelby County. And very soon, immediately after the Christmas holiday, our first responders will begin to receive vaccines, shots in their arms, so that we can begin ensuring that our police officers, firefighters, EMTs are also safe as they interact with the community. And that's not all. There are many, many more doses to come. Dr. Haushalter has a comprehensive program for the immunization according to phases. Our hospital systems have a program of immunization according to phases. So we're starting with our frontline healthcare workers, our frontline public safety officials, and then it will go down from there to critical infrastructure workers and people with comorbidities who are at risk of contracting and becoming very ill from this disease. So that is good news. We continue to follow that. As we get more information, we will pass it along to you. I also want to say it's very good news because our healthcare workers and our first responders will be able to testify to everyone about the impact of what they felt when they got their immunization. The symptoms so far seem to be incredibly rare if anyone has any ill side effects. So if you're looking for information about the vaccines, you can find those at the city's website, covid19.memphistn.gov. We have a link there that will take you to the vaccine information that will talk to you about all of the potential symptoms, again, which are very mild, and there are rare exceptions when someone, just like any other immunization, where someone might have an adverse effect. Very rare, typically very mild symptoms. So with that, I'll stop and we'll take any questions.
Andrew Douglas, WMC.
Hello, everyone. Dr. Randolph, you mentioned second in the nation, Tennessee is when it comes to new cases. Can you speak to what's happening in the Mid-South and the state that's causing our numbers to accelerate so much faster than everybody else? And what are other states doing differently?
Well, I think one of the things, when we look at the data, we see that, in the South, there's an increase in number of cases. I think if you map out where the cases are occurring, I think it correlates with the uses of the mask. Unfortunately, we're dealing with a situation where wearing the mask has become a political statement, a defiant statement, and therefore you see that in places, certain places, people just are not wearing them or are not wearing them as they should. And if I had to pinpoint one thing, it would be wearing the mask. And then the second thing would be the social distancing and the avoidance of crowds and gatherings. Those are the contributing factors that explain the odd numbers, in my opinion. Do you have a follow-up?
Okay, I do. Dr. Alisa Haushalter, this one's for you. There's a New York Times article with a coronavirus outbreak tracker. It shows half of the cities with the growing COVID-19 cases are in Tennessee, mostly in East Tennessee. Can you explain why that might be and provide any insight into those numbers?
Well, so there's a few things to keep in mind about the state of Tennessee. The first cases occurred in Shelby County and Davidson County. We were literally a day or so apart. East Tennessee didn't begin to experience its cases until much later. And then other things have happened in that area. Again, you have to take either a statewide approach or a regional approach. There isn't consistent masking in East Tennessee, and that's critical. We also know that the Knox County Health Department has discontinued or will shortly discontinue doing contact tracing. And we know that's a critical component of being successful in reducing transmission. I would also, I'm going to make a comparison. It's not necessary to make a negative comparison of Knox County. Is locally we have had a very strong partnership. And so when there are limits in one system, the other system helps. So in the beginning, the health department did the majority of contact tracing with the exception of some hospital systems. But as the cases have grown, everyone's pitching in and helping to get people isolated or quarantined. That is not happening in Knox County. So I would think it's a combination of all those factors that make East Tennessee a little bit different than where we are currently in Shelby County.
Jane Roberts, Daily Memphian.
This is a question for Dr. Randolph. It was interesting to me that you said that people under 40 going into a public place should assume that they are infected or will be infected. Can you comment on what that means for schools that are meeting in person?
Well, I think that actually has even a broader meaning. You know, so even when we look at our numbers, we see that the number of cases are higher among people 18 to 35 to 44. That age range makes up the bulk of the number of cases that we have, because that group and even younger are engaged in activities that they feel that they're not vulnerable to the infection, the gathering, the hanging out, etc. Certainly, when we look at the school-age population, K through 12, we see that there's definitely an increase in the cases among children. Now, part of that is that we see increase in cases because prior to the reopening of schools, kids were being sheltered at home and were not being exposed, and so therefore, and probably not even being tested. And so we didn't have the data. Now that kids are back in school, are exposed, we look at our data and we see that numbers of infection among school-age kids are higher than they were prior to schools opening. And mere fact that they're there and gathering. But when you look at school-age children, it is primarily the ages 14 to 18, more your teenagers, because again, they're hanging out, they're doing things. Even when we look a little deeper at the school-age related cases, a lot of those infections is not so much the result of them being in school or even participating in a school-sponsored sport activity. It's the things they do outside of school, the extracurricular activities and the hanging out and just doing what young people, teenagers do, that explains a lot of the transmission. Is there a follow-up?
No, thank you.
Jenny DePrizio, Local 24.
So my question has to do with hospitalization. We've seen this week, 97% capacity in the ICUs, 98% capacity, just real high numbers. What happens when we get to 100% to capacity? Some states are looking at possibly rationing care. Is that something that we're close to here in Shelby County? What is the situation as we approach the 100% capacity
I'll
levels?
let Chief Gowan speak to that.
Well, thank you for that, Jenny. That's a good question, and I know that is one of concern. So let me just say very plainly up front that our hospital systems are managing their census on a day-by-day, hour-by-hour, and minute-by-minute status. And so there is a continuum of things that they can do. They can expand the ICU capacity by bringing additional rooms with ICU equipment online, and that's what we've seen in the last few days, where they're actually, if you pay attention to the numbers of available ICU rooms that are staffed, you'll see that number has grown slightly. And so our hospitals, what you don't want to have is lots of ICU capacity that's unused but staffed. And so they are doing a good job of managing their census today to try to ensure that they meet the demand that is there. In the same with acute care beds. The message I want everybody to hear is, though the numbers are very high, there is still capacity to treat people who are very sick, who need hospital care. So please, if you need hospitalization, if you think you need to go to the ER, if you believe that if you're supposed to be admitted, then go. There is capacity to care for you there today. We have been meeting regularly with the hospital CEOs, their chief operating officers, their chief medical officers. There are allowances under Tennessee, the governor's executive orders that allow increased scope of care responsibilities for individuals. There are some allowances with licensures that will allow additional people to come in. And so our hospital systems have been discussing about how they will bring that additional staff on, how they can extend, for instance, the nursing staff's ability to care for a larger number of people by bringing some what we're calling force multipliers or nurse multipliers on. And so, yes, we have reached, under our normal staffing models, the high 90%, and the hospitals will now begin to enact those measures that will bring additional staff multipliers, and extend their ability to care. The question is, logically, when will we reach our limit? We were just talking, in fact, yesterday with the hospital systems about recalibrating what we believe our actual limit will be based on what we know today about the numbers of people that could potentially come on to help. I don't have that answer for you today, but that is something that we are managing each and every day. But again, our hospital systems do have the capacity to care today for an increased patient load.
As a follow-up, do you know, if you said that they've increased their capacity, do you know how much it's increased? And under that scenario,
Sure.
that if they're increasing, is there a point where we'll actually never get to 100% because they'll keep increasing capacity? Does that make sense?
It absolutely makes sense, Jay. It's a very logical question. And clearly, we hope that we never get to 100% because we always hope that we are there. There may be a point in the future, but exactly what you said, that's the point we're looking for, is knowing everything we know today, with all of the staffing tools that the hospitals have at their disposal today, and forecasting how they might use those in the future, as well as, you all have heard me talk about the Medical Reserve Corps. Just recently, we had about 117 people sign up for that, and so thank you to any of you who did that. We can begin to use those individuals in the hospital systems, and hospitals can pull from the Medical Reserve Corps to begin filling out those staff. So that's a changing number as well. But going back to what I said, knowing what we know today, the staffing protocols that the hospitals may be able to put into place to extend the scope of care and to give more capacity for care, and knowing the number of people that we might be able to pull in, they are working now to try to help us understand where we will reach that critical limit. And so, yes, to your specific point, we may never reach that 100% if we continue to expand the existing care, ability to care that we have right now.
Daniel Connolly, Commercial Appeal.
Yes, hello. Quick question. I know that the officials have spoken about a new health directive. Could you just bring us up to date on the status of that, what's under consideration, and when you might make a decision on updated health directive?
As Dr. Randolph noted earlier, we're exploring what all mitigation efforts that we can put in place locally that are going to have a significant enough impact to reduce transmission. We were working on Health Directive 16 with an emphasis on language clarity, not necessarily to add additional restrictions, but we do have to look at more broadly what interventions will help over the Christmas holiday. We do not anticipate releasing that directive today. It's probably likely early Monday before that's completed. We're considering everything. As Dr. Randolph used the White House report earlier to read from, we do look at national recommendations in addition to what we recommend locally. So we tend to have our internal conversations first. Then we'll compare that to what's happening in similar communities, what's worked in those communities, what hasn't, and then also look at the White House recommendations. Those then get presented to the mayors, that's all the mayors. There's additional discussion there, and then we come to a final decision as the result of all those discussions. So I can't share specific details at the current time on what those things are that we're considering, but we do know we have exponential growth. And that growth is occurring because people are continuing to socialize together in their homes and in public places, in workplaces, and so on. And so anything that we do is going to have to decrease the ability of people to come together and socialize. Do you have a follow-up?
No, thank you. I appreciate the answer.
Katie Reardon, WKNO.
Hi, Doug. I was hoping you could tell me a little bit more about those 117 people who signed up for the medical corps. Are those doctors, nurses, other support staff?
Sorry about that. Thanks, Katie. I don't have the details in front of me, but yes, it is an array of medical providers. There are medical doctors, nurses, nurse practitioners, medical assistants, and then there are other people that are just want to volunteer to help. So we appreciate what everybody has done to step up to the plate. We frankly can use more than 117 volunteers. I also want to give a shout out to our nursing schools and our medical schools here. We have the Baptist, Southwest, University of Memphis, and UT, all of whom are coming together, and they're working on a plan to consolidate their students to get clinical hours by helping out with things like vaccinations, and they're exploring some other opportunities. So people are really pulling together. It is inspiring to see the lengths to which people are going to help out. Again, if you have any notion that you would like to help, I encourage you to go to that Medical Reserve Corps. As I said, we do have a good mix of individuals who have signed up already, and we hope to put them to good use very soon. Do you have a follow-up, Katie?
I do, yeah. I'm wondering, you guys had predicted that by Christmas there would be by the end of the year there'd be 500 people in the hospital, and we've already exceeded that. So I'm wondering what the updated predictions are.
I know we'll have another task force meeting and on Friday morning, and Dr. David Sweat's not here today with us, and I know his data team will give us a new projection. We look at that. He looks at it every day, so we can get you back with an update. But clearly it will be higher than the 500, given especially today the new case rate. And so what we should expect is that number to grow in our hospitalizations. We are looking at the system from stem to stern. So the number of people who are coming to the hospital, the number of people that are being admitted, and equally as important, getting people discharged in a timely fashion to other places where it is more appropriate for them to recover, whether that's at home or a long-term care facility. So there are actions all along that spectrum that we can take to make sure that we have the appropriate throughput for individuals who need that kind of care.
You mentioned early treatment.
Oh, yes. Let me mention that too. Dr. Haushalter can fill in the details because I am not a medical doctor nor a doctor of nurse practitioner or a doctor of nurse practice. But I do know that there are early treatments that people in the early phases of a COVID infection can get that will dramatically reduce the likelihood that they need to be hospitalized, and that is monoclonal antibody treatment. And so individuals in the early phases of their diagnosis should press their doctors to refer them for monoclonal antibody treatment. Did I get that right? Okay. That is a great tool. Just like vaccinations, we are getting more and more doses of monoclonal antibodies. And early treatment with that is shown to, it's a huge percentage of people that will not need to be hospitalized with that treatment. So please ask for that if you're infected. I think we're out of time, so do you have any last comments? I have one last comment for everybody that we have not really talked about here today. Wear your mask, get tested, know your status, wash your hands, avoid crowds, avoid gathering with people that are outside your household. Haven't talked about it in a while. Do not assume that your symptoms are seasonal allergies and then leave your house. Do not assume that you simply have a common cold and leave your house. You cannot assume that anytime you are feeling differently than you normally do, that it is anything other than COVID-19. The symptoms manifest themselves in different ways in every individual, and there are far too many cases, far too many cases of people saying, it's just my allergies and going to work. It's just a cold and going to work. Dr. Haushalter and I were just talking before this. We have seen case after case of people being at work for 3 and 4 days with those kinds of symptoms, chalking them up to being just seasonal allergies, and then surprised when they get tested positive for COVID, and now their entire workplace has been infected. I implore you, do not assume that your symptoms are anything other than COVID-19. You must assume that they are. Thank you.
Thanks, everyone. Stay healthy, get tested, and we will see you back here on Tuesday.